Hello, everyone, and welcome back to another edition of Nursing EDge Unscripted podcast. I'm really excited today to talk about today's topic, which is we're going to talk about a call to action article that was just released by ASPE called Honoring Simulated Participants and Collaborating with Simulated Participant Educators. Lou, I told you, I saw you at IMSH and I said, oh my goodness, we have to have a podcast about this article because I learned so much, things that I was not doing correctly when it comes to the way that we, again, honor our SPs. So I'm glad to have you here today so we can talk a little bit more about this call to action and what kind of brought you to writing this article. So first, before we begin and really get into it, do you mind just introducing yourself?
Yeah, absolutely. Kelly, thanks for having me on. I'm really excited to share some of this information with the National League of Nursing and your members. So for those I haven't met, I'm Lou Clark, and I'm the current president of the Association of SP Educators, ASPE. And for those who don't know us, you can find us at aspeeducators.org. We're a global organization. We've been around for going on 25 years, and our whole mission is to promote human interaction in healthcare education and training, working with our simulated participants using SP methodology, but not using people. So is really the heart of this call to action. And for those unfamiliar, SPs are individuals trained to portray a role, to give constructive feedback to learners, and they're really the heart of what we do as SP educators is we guide, we coach, we safeguard our SPs through this process, because unlike other sort of simulation modalities that are essentially inanimate, which are tools for learning, SPs are not. They're human beings. And that's at the heart of this. So the reason that I came together with the 9 other authors of this short call to action is that over the years, we've all sort of experienced different language use, different ways people interact with SPs, with us as SP educators. And we felt it was time to sort of come out and say the things that we know in our community that are sort of tacit in a way when we're around others who are not immersed in the work. And we thought, let's just, get it on the record for everybody. This is how we want people to talk about it. And it's on us, right, to get together and say, please do this. So we wanted to issue a call that anybody can join us. We want everybody to join us. We want to be inclusive about how we approach it. And we don't want to shame anyone who have been doing some of the things we write about in the call. That is not what this is about. This is about saying, join us. Come on, come with us. We want you to get on board and the inclusivity train of working with SPs and SP educators.
Right. So you kind of answered my first question, which was what inspired you to write the article. But what was the biggest message that you wanted simulationists to kind of take away from reading that article?
Yeah, so I think it evolved as we wrote it. And the biggest sort of what makes this piece different than some that have come before is some of the messages have been written about for years, quite honestly. So Deborah Nestel in Australia has been a real champion for the phrase simulated participant. I really have to credit her because she's come out early years ago and said, we really need a more inclusive term for describing the work that SPs do. And while a bulk of the work, of course, is in healthcare, importantly, the other thing that makes SPs really interesting and unique in our work is that we go beyond healthcare. We work with police departments. We work with superintendents of schools and leaders to train them in conflict management and other types of communication-related skills. I've developed a training for chaplains in the Marines using SP methodology, but not using SPs. And so I really want to credit Deborah. And so what makes this a little bit different is that 10 of us from around the world decided we're going to get together in a concentrated short period of time. And we're going to almost like, I would say we had a little idea think tank, right, last spring. And we said, you know what, we are just so uncomfortable seeing the phrase using SPs. We don't want people to do that anymore. And then at the same time, members with an ASPE, you know, we had done a compensation study, quite frankly, in our last membership survey, and we found that we really need to better describe in detail the work that SP educators perform. So what makes this different? I had hoped you'd ask this question. I'm going to read the sentence that I think makes it really different, which is the end of the first paragraph. And it says, we call the global simulation community to action now because as leaders, we recognize our responsibility to examine key tenets core to SP methodology in a novel way that explicitly amplifies the hidden work of SP educators in relation to the contributions of SPs. To me, that's the heart of what is different, because the hidden work, the work that people don't see, we need to call it out. People, it's like any profession. There's so much that goes on behind the scenes. And in order to truly value it, to compensate SP educators accurately, to understand why these people are needed, why we're needed, and to support and guide the SPs and provide that safety, we have to say it. And so that's, to me, what makes this different than other, you know, really great pieces that have come before it that touch on other aspects of this.
Absolutely. And even for me, it was an aha moment. I've been in simulation for about 16 years. And I felt the article was speaking to me because some of the things that you talked about, like, oh, I have an SP case, I'm using an SP, that's been in my vocabulary. And that article made me pause and said, let me really rephrase and rethink the way that I'm, you know, it's almost like I'm taking, you know, an individual and turning into a piece of equipment, or, you know, so I do appreciate this article so much. And I think, you know, we needed this. And one of the other questions I have for people, because a lot of people are new to simulation, or maybe they haven't had kind of that training or education on how to incorporate SP methodology into their curriculum. So how can simulation programs and simulationists, whether it's directors or deans, ensure that simulated participants feel valued, respected, and integral to the education process?
I love that question. And I think there's so many ways that are sort of local ways, bigger ways. I think just from a really local perspective, if you are part of a sim program that has an SP program as part of your, say, a more comprehensive program that also has technical simulation. My home institution is University of Minnesota, and we have that. I happen to be the executive director there. And so in my role, I think it's meaningful for the SPs and the SP educators when I pop into the SP training room and I say, thank you for your work. I mean, there are such basic things that folks can do to demonstrate, who are in leadership roles, to demonstrate, I care about the work you're doing. Tell them, you know, like send the occasional simple and free, right? Like send a message. Like if they've just done a major ASPE, send a message to them that says, we really appreciate everything you do to help our learners. You know, that's another thing, is simple written communication. Some other kinds of ways that we talk about in our call to action have to do with the full-time or part-time SP educators who create the events that, quite frankly, lots of tenured faculty members write about to get their tenure, right? I've encountered this so many times. My work before I got a doctorate, which I did later in my career and go on and get a faculty member, my work has supported others in getting their tenure. And there have been times where maybe I've been acknowledged, which is always nice, but when you don't have that authorship, that equal collaborative authorship on the work that would not have been possible with your labor, it's holding back an entire profession, quite frankly. And I don't think it's intentional, which is the other piece we're really getting at, which is very explicit. And I think a novel thing in this piece is saying there are people coming up as SP educators. And what was really great in my experience, I started off at the University of New Mexico and was put on a small grant project my second week of work. And it changed my life because I had mentorship. And people recognized that they thought, this is a person who may go on in this career field. I was hired as an SP trainer. I love the University of New Mexico, still friends with them. I got my master's of fine arts in playwriting there. And they hired me and realized I had an aptitude for writing curriculum that was SP based because I understood writing a script that was brought to life. And
Mhm.
so I'm really grateful to the people who mentored me there. And I think it's about mentoring. It's about looking at the transferable skills that your SP educators have and recognizing that the skills that go with things like developing an SP case, that go with training, these should be things highlighted and included, even briefly, in peer-reviewed publications. And SP educators should be included as co-authors, and that changed my life. They stuck me in the middle, so like of a bunch of authors, and it didn't matter. They introduced me to the process, and that was
Mhm.
a really big deal. That was 18 years ago.
Wow. And talk
Mhm.
about finding a way to value SPs. I think for a lot of simulation programs, when they think of collaborating with SPs, it's simply you're in this scenario, I need you to play the role of the patient, and that's it. And so I love the fact that you really just then explained that it's some SPs can contribute so much more to our simulation curriculum.
Yeah, and I
Playing the
should
role of
add to that, another way to value the SPs is, asking their perspective and paying for their time for that perspective.
absolutely.
So if we're working on a new piece of curriculum at our institution, there are times we will ask our SPs if they're comfortable to give us some insights into the case.
Mhm.
And that's really important, depending on what sort of curriculum you're working on. And I'll just say broadly, if you want to include voices from underrepresented patient populations, it's really critical to involve them in developing those scenarios so they are authentic and they are going to really, they're going to serve the learners best ultimately in achieving clinical learning objectives when you are holistic about how you develop it. And SPs are wonderful partners in that respect.
Excellent. And that kind of leads me to my next question too. Can you share insights or examples how effective collaboration with simulated participant educators has positively impacted learner outcomes?
I mean, I look at our whole profession, quite honestly, because it's interesting. This profession, SP education, goes back to 1964 when Dr. Howard Barrows got the idea to innovate and work with SPs. And so for 60 years, this began as assessment, really. That's really, it started with him and he was working with neurology residents and then quickly went into let's medical schools taking this up to assess learners. And there is tons of literature that for, really, if you look at the 1980s and 90s, it was like an explosion of literature about how SPs are incredibly valid and reliable raters. So SP programs and, it started more in medical education. So a lot of physician educators and leaders had SPs doing the rating. And what they also learned was it was more cost effective for their institutions. That's
Mhm.
really where this burgeoned and kind of went to there and very, I think, very wonderfully, nursing began, pharmacy began. You
Mhm.
saw other programs in the 70s begin to experiment, and quickly in the 80s, people think, oh, nursing recently came to this. No, the first nursing publication that discusses working with SPs is from the 1970s. So what began as assessment is now more, I think, in an exciting way, different health sciences programs are experimenting with formative sessions. And I see that I teach with SPs. I say with SPs, I'm a co-course director. I am, and just for your listeners, I don't have clinical background. My background is theater and a doctorate in health communication. And I work with 4 physician colleagues. I'm a course director of our clinical skills course for first and second year med students. And I partner with SPs to teach relationship building skills with our new students across different campuses. What does that mean? It means I'll introduce a concept about whether it's about nonverbal or different verbal ways to, things to say to develop that relationship, build that trust in the second week of school. And I have SPs in the room with me and students working in small groups. So I'll suggest some strategies and then they immediately apply them. And what I see is right there in real time. I see it in the course evaluations. There's proof there.
Mhm.
What's their favorite thing about the course? SP, SP, SP.
Yes.
Yeah, so I've
I can
seen
tell
it.
you that firsthand. Mhm.
Yeah, so to kind of bring it around to your question, I think there's just absolutely tons of evidence in the literature for decades that SPs make valid and reliable raters when when you're working on assessments, and that's across all kinds of health professions. And then just there is also literature out there about the value and the contributions of SPs guided by, going back to your question, guided by SP educators for these formative sessions. And what we all have to pay more attention to is in our method sections in peer review articles, not leaving out even a few sentences explaining how the SPs are trained, because that's historically been left out of a lot of method sections. So another way people can kind of join the call and speak to this in your own institution, go to your SP educator and say, how did you train the SPs? Can you write this section? Can you write me a couple of sentences here? It's going to make it better.
Mhm.
And what I hope I stop seeing is the SPs were trained, because it doesn't tell us who, it doesn't tell us were they trained in accordance with the ASPE Standards of Best Practices, a freely downloadable article we're in the process of revising that was published in 2017. So really just giving a couple more details is meaningful, because if we don't describe how the SPs are trained, in my opinion, the outcome data is less valuable, because it's human interaction, right? So it's variable. So if you describe better the training protocol, you can understand the depth that SP educators go to ensure consistency across learners. I think that's an important part of that.
Mhm. And so I want to also ask you, as we have some listeners who are, again, new to simulation, new to using SP methodology, where can they go if they want to, find out what are the best practices when it comes to SP methodology, or even how to hire SPs, to how to have SPs, when it comes to evaluation process? Where are those resources? Where can people go to find more information about best practices?
Yeah, I'm so glad you asked that. And the good news is, listeners, you can do it after you finish this podcast. Just click on aspeeducators.org. We have so many resources from our members, and one is a freely downloadable bibliography by Dr. Karen Zouder, a longtime member, physician out of Galveston. Her hobby is research. She has a database with 7,500 articles from 1964 to now. And you can download that in an Excel spreadsheet that's searchable. So we give that to you just by visiting our website. If you become an ASPE member, you'll have access to online modules developed by many of us, by so many different experts in the field. And there is a Center for SP Methodology, and you can go through on your own time an online course with many, many lessons and modules about the things you're asking about, Kelly: how to recruit, how to train, how to coach SPs in providing verbal feedback to learners, all sorts of different modules. And I'm a longtime member of the ASPE Grants and Research Committee. Our committee is currently working on several different modules around best practices of research, doing research with SPs and SP educators. So we offer that. We have our big conference coming up, and that's once a year. That's going to be in Montreal from June 1st through the 4th. And we're going to have our very first ever human simulation research forum as part of this conference. So we're really excited about it, and we want to come out of that with an ASPE-driven research agenda, taking us forward into the next 25 years of ASPE. So I think there are all kinds of resources. So we do monthly webinars as well, because we want to reach out to people across the world who are our members. So we are all things SP, in addition to the publications, the best practices in this publication. There's so much there. And my favorite part about the ASPE community is that I think it's a very caring community. We care about our learners, and we really care about our SPs, because it is our job to ensure that excellent learning with SPs happens, and that it does not come at the expense of the physical or psychosocial safety of anyone involved, including and especially the SPs. So that's sort of, I think, our guiding kind of touchstone, is that SPs are wonderful partners and we want to value them and all of that, and we want to work with them. But learning for health sciences students should not come at the expense of the SP. And I just sort of think it's sort of antithetical to the whole thing, because the SPs are people. They're actually patients, right, in their own right. So we should in no way compromise patient safety, because they're human,
Absolutely.
because they're in a learning role, right? Teaching and learning role, right, with the students.
Well, thank you. Thank you for providing all those resources. It sounds like ASPE is a one-stop shop, and you can go there and get as much information as possible for those of us that want to improve the way that we work with SP. So I appreciate that. And we'll make sure that we include the website for ASPE for people who may be interested. So one last question for you. So where do you see the future? So what are some of the trends and innovations that you see in the field of simulation regarding the role of SPs?
I appreciate that. I think it's critical, and I'm going to speak to SP and SP educator, because I think it's really important to make that distinction, and the call to action does that. Again, kind of bringing it back, that the SPs are often front-facing with the learners, and I would say 80% of the work SP educators do, including that work of developing scenarios collaboratively, coaching the SPs on how to provide accurate and helpful verbal and written feedback to learners. That is done in the shadows. And so I think I just want to call that out. So for the future, I think, and this may be surprising to listeners coming from the president of ASPE, I think we need to embrace technology. I think we need to be in step with the latest technologies. And I'll tell you, in my almost 20-year career, I've had friends sort of that are more familiar with technical sim, kind of like, kid me a little bit and say, Lou, there won't be SPs X many years from now. And my response to them is, I'm still here. The SPs are still here. We got over 1,000, we got close to 1,000 members in ASPE. And I think it's a collaboration. So I think it's critical that we're working collaboratively with technical simulation educators and colleagues and people who really are into using the technical simulation modalities, people on the forefront of AI. I think it's critical that we inform that work, because at the end of the day, patients are human. And so in that respect, I think SPs are the highest fidelity, simulation modality you can get. And I think SP educators are uniquely qualified individuals who understand what it takes to coach other people to get the maximum benefit for learners. That's the gift that SP educators give. They understand how to literally bring curriculum to life, and we do it over and over and over again. And that's exciting to me. I think that that's the gift that SP educators give, the hidden work that supports all of this. And you have to be so vigilant and so committed, because it takes the commitment of daily practice. You can't take your eye off the ball to ensure safety when you're working with humans, when you're working with people. And in that way, it's akin to patient care, right? As a clinician, I know you are so dedicated. There's so many dedicated listeners out there. We give that same commitment every day to make sure that our SPs can be on stage, front and center, doing the work they need to do with the learners who are also front and center.
Well, thank you, Lou. I really appreciate you taking the time out to have this conversation and talk about this very important article, which, again, for those of you who are interested, please read this article. It is Honoring Simulated Participants and Collaborating with Simulated Participant Educators. It's a must read for anyone in the simulation field. So thank you again for taking the time out. We're so glad to have you as an ASPE president to give us some insight on how we can, as simulationists, do a better job of honoring our SPs. So thank you so much.
Thanks for having me. And I just want to say thanks to your members for listening, and please reach out to us if people have questions. We want to help. We want to welcome you to the community, and it's all about working together. So thanks for having me.